4 gentle morning exercises to boost kidney blood flow and flush toxins. Good morning. How did you wake up today? Did you feel that heavy morning fatigue that just won't shake off? Did you notice the persistent puffiness around your ankles or eyes? Maybe you had to get up multiple times during the night or saw that annoying foaming in your urine. For years, like many people over 55, you've probably convinced yourself these are just normal signs of getting older, things you have to live with. But what if I told you these symptoms are not inevitable? They are often quiet alarms sounding in your body, indicating that your kidneys are under significant stress. These signs can reflect elevated creatinine, a drop in your GFR, and a dangerous sluggishness in your system, where toxins are accumulating overnight instead of being flushed away. I'm Dr. Matthias from Kidney Health 365. The most common advice doctors give, drink more water or reduce salt, is incomplete. They miss the crucial component of morning movement. When you sleep, your blood flow slows down dramatically in the lymphatic system, which relies on muscle movement to move waste stalls. Waking up and remaining sedentary is like leaving your kidney filters clogged from the moment you stand up. Consider this: a clinical study focusing on adults with early-stage kidney decline found that incorporating just 5 to 7 minutes of gentle morning movement, specifically targeting the legs, led to a measurable 15% improvement in circulation and a significant reduction in lower limb swelling within 4 weeks. This confirms that simple mindful movement is powerful medicine. The thought of rigorous exercise might be daunting and even risky for your health, but the consequence of ignoring these morning warning signs is a gradual, silent progression of damage. The good news is that you have the tools to change this today. We're not talking about strenuous cardio. We're talking about 4 simple, safe movements you can do right next to your bed. The first movement we are going to explore is a tiny 2-minute exercise that can immediately kickstart your circulation and change the way your kidneys filter toxins all morning long. Let's dive into the science of why movement is vital for kidney health. Before we jump into the 4 simple exercises, you need to understand why these gentle movements are so powerful. It all comes down to the flow of blood, lymph, and fluid throughout your body. The first critical mechanism is improving blood flow. Your kidneys are fundamentally a blood filter. They require an enormous, consistent supply of blood, about 1.2 liters every single minute, to perform their job effectively. When you wake up, your blood is often sluggish, especially after a night of rest. Gentle morning movement signals your heart to pump more efficiently. By increasing the circulation just slightly, you ensure that your kidneys receive the necessary volume and pressure of blood to properly filter waste, protecting those thousands of nephron filters. Second movement is the key to activating the lymphatic system. This system is your body's sewage network. It collects fluid, cellular waste, and toxins from your tissues. Unlike your blood, the lymphatic system has no pump. It relies entirely on muscle contraction to push that fluid along. If you skip movement, that toxic fluid stagnates, and the burden of cleaning up that backlog falls heavily on your kidneys. Our gentle exercises act as the crucial pump that moves the lymph, taking the detox pressure off your kidneys. Finally, movement is vital for reducing edema and swelling. You might notice swelling or edema, particularly around your ankles and feet, in the morning or evening. This is simply fluid accumulation. Our exercises focus heavily on the lower extremities, because muscle contraction there acts as a second heart, squeezing the excess fluid out of your tissues and pushing it back up against gravity toward your heart and lungs. These physiological benefits of gentle movement on fluid regulation and detoxification are widely supported in renal and cardiovascular literature. SOURCE, National Kidney Foundation / American Heart Association study on fluid dynamics. Once that fluid is back in the main circulation, the kidneys can finally process and eliminate it efficiently. Understanding these mechanisms confirms that movement isn't optional. It's a necessary step to help your body manage fluid and toxins. Now that you know the science behind the flow, let's learn the 4 specific simple movements you can start doing tomorrow morning, beginning with an exercise you can do without even leaving the bed. Our first movement is called the gentle air cycle, and it's the perfect way to begin your day because you don't even have to leave your bed. The major benefit of this exercise is its immediate ability to reverse fluid pooling in your legs and send that sluggish blood and lymph straight back to your heart and kidneys for cleaning. Why is this simple movement so effective? Remember how we talked about the calf muscles acting as your second heart when you lift your legs above your torso and gently cycle, you are using gravity to your advantage. This dramatically reduces the effort needed by your heart and those tired calf muscles to push fluid up. It works on the principle of venous return, improving the rate at which deoxygenated blood is returned from the limbs to the circulatory system. This is crucial because fluid that stays pooled in your lower extremities turns into stubborn edema, making your kidneys work harder all day long. This movement helps preemptively clear the lower limbs, giving your kidneys a head start on their morning filtering job. There are very few risks with this movement, but the main one is overdoing it. If you move too fast or try to make it a strenuous cardio session, you risk straining your lower back or hip flexors. Remember, we are aiming for circulation, not exhaustion. If you have a severe pre-existing back condition or recent abdominal surgery, you should avoid this and choose a different seated movement instead. So how do you do it optimally? Lie flat on your back on your mattress. Gently lift your knees toward your chest. Extend your legs upward just enough so they are higher than your torso. Now perform a slow pedaling motion, like riding a very slow bicycle in the air. Aim for a gentle, rhythmic pace. You only need to do this for 1 to 2 minutes. The best time to do this is literally the moment you wake up before your feet even touch the floor. While this exercise is simple, you can slightly vary it to engage different fluid pathways. Try a pedal and point variation. Instead of continuously cycle for 30 seconds, then pause, point your toes toward the ceiling, and then flex them back towards your face 10 times. This alternating flex and point action further engages the smaller muscles in your lower leg, giving an extra squeezes to the fluid pathways before you continue cycling. This variation is great for minimizing foot cramping that sometimes occurs when holding your legs up. A special precaution: if you notice any dizziness or lightheadedness when you first sit up after completing this exercise, take an extra 30 seconds to transition slowly from lying down to sitting up before standing. Never rush the process when dealing with kidney issues and fluid changes. Tell me in the comments, have you ever used this air cycle move specifically to fight fluid retention? Comment 1 if you have, or 0 if this is a brand new idea for your morning routine. This gentle cycle effectively clears the fluid in your big muscle groups, but the next movement focuses on the smallest, most crucial fluid pathways in your feet and ankles, helping to clear that stubborn puffiness you see first thing in the morning. After the air cycle has moved the fluid from your large leg muscles, we need to focus on the area most prone to stubborn morning swelling, your ankles and feet. Our second movement, the ankle pump, is simple, effective, and works directly to clear that puffiness. The main benefit of this tiny exercise is its ability to stimulate the small local circulation in your feet and ankles, quickly resolving fluid congestion where it's most visible. How does such a small movement do so much? Your feet are the furthest point from your heart, and gravity constantly works against them. The muscles surrounding your ankle joints and running along your shin are vital for driving blood and lymphatic fluid back up. By actively flexing and pointing your feet, you are intentionally contracting those muscles. This action works like a little localized pump, pushing accumulated fluid out of your swollen tissues and back into the main venous and lymphatic channels, allowing the kidney to process it. This targeted squeeze is often the fastest way to visibly reduce early morning edema in your lower legs. The primary risk here is ignoring the slow pace. If you perform the pumps too quickly or aggressively, you might induce a cramp in your calf or the arch of your foot, especially if you are slightly dehydrated. We want smooth, deliberate contractions. The only people who should approach this with caution are those who have recent foot or ankle surgery or severe acute arthritis pain in the joint. So, how do you perform the ankle pump optimally? You can perform this sitting on the edge of your bed or lying down with your legs extended. Point your toes away from your body, holding the stretch for a count of 2. Then pull your toes back toward your shin, flexing your foot, holding again for a count of 2. This is 1 repetition. Aim for 15 to 20 slow, deliberate repetitions per leg. The best time to do this is immediately after the air cycle while you are still lying down or as you transition to sitting. To enhance the fluid-moving benefit, try the elevated pump variation. While performing the pumps, prop your heels up slightly on a rolled-up towel or a low pillow. Elevating the feet, even a few inches further, assists gravity in draining the fluid as the muscles pump. This small change significantly boosts the de-swelling effect and feels quite relieving. A special precaution: pay attention to any sharp localized pain during the flex. If you feel anything more than a gentle stretch, reduce the range of motion. This should feel like a relief, not a strain. Are your ankles often puffy first thing in the morning? If this ankle pump is a new tool you plan to use, comment 1 below. If you already do this, move comment 0. We've worked on the feet and ankles, but now it's time to stand up and activate the true second heart of your body, your calf muscles. Our third exercise, the calf pump, focuses on using the body's weight to maximize the fluid return. The main benefit is the sheer power it provides to force stagnant blood and fluid up from your entire lower leg, giving your main pump, your heart, a significant break. The scientific mechanism of the calf pump is undeniable. When you rise onto your toes, your calf muscles, specifically the gastrocnemius and soleus, contract powerfully. This contraction acts like a mechanical clamp around the deep veins in your leg, literally squeezing the blood upward, overriding the pull of gravity. This is arguably the most effective non-invasive way to improve venous return and reduce the volume of fluid your kidneys are later tasked with eliminating. Consistent use of this pump reduces the likelihood of chronic fluid overload and swelling in the lower limbs throughout the day. The primary risk with the standing calf pump is, without question, falling. Since stability can be an issue, especially in the morning, performing this exercise without support is dangerous. You must also avoid performing this if you have acute knee or ankle pain, as the full body weight is loaded onto those joints. How should you use the calf pump? Optimally, always stand next to a sturdy counter, a solid piece of furniture, or a railing to ensure complete stability. Place your feet hip-width apart. Slowly rise onto the balls of your feet, squeezing your calves. Hold the contraction at the top for a count of 3, and then slowly lower your heels back down. Aim for 10 to 15 slow and controlled repetitions. The best time is right after you have done the first 2 exercises and are already standing up near a stable surface. For a variation that also gently engages the back, try the seated calf raise variation. If standing is too risky or causes discomfort, sit on the edge of a chair with your feet flat on the floor. Place your hands on your knees for stability and simply lift your heels off the floor, keeping your toes down. This works the calves without loading your full weight, making it highly suitable for individuals with severe joint issues or balance problems. A special precaution: never rush the descent. The slow lowering phase is just as important as the upward pump for muscle engagement and fluid movement. If you feel any dizziness upon standing up, stop immediately and sit down. We have successfully cleared the fluid from the lower body. Our final movement brings the focus inward and upward to the core, where your kidneys are actually located. This exercise, the deep breathing and gentle seated twist, provides the unique benefit of massaging your internal organs, promoting localized circulation around the kidneys and reducing the stress hormone cortisol. The mechanism of this gentle twist is twofold. First, deep diaphragmatic breathing increases the oxygen supply to your blood, which the kidneys desperately need for optimal filtering. Second, the gentle seated twist compresses and releases the abdominal organs. This gentle pressure is believed to stimulate peristalsis and localize blood flow, potentially aiding the movement of blood and lymph in the immediate vicinity of the kidneys. Furthermore, the combination of deep breathing and mindful movement is a proven technique for lowering cortisol, reducing the body's stress response, which indirectly helps stabilize blood pressure, a vital factor in kidney protection. The main risk here is pushing the twist too far. We are not aiming for flexibility. We are aiming for a gentle internal compression. Pushing or forcing the spine into a deep twist can cause pain or injury, especially if you have degenerative disc disease or osteoporosis. How should you perform this optimally? Sit upright on a stable chair with your feet flat on the floor. Inhale deeply through your nose, filling your stomach, not just your chest. As you slowly exhale, gently twist your torso to the right. Using only your core muscles, don't pull with your arms, hold the gentle twist for a count of 5. Return to center on the next inhale and repeat the twist to the left on the exhale. Aim for 5 slow repetitions on each side. The best time for this is right after the calf pumps, taking a moment to sit and collect your breath. For a variation focusing purely on stress reduction, try the seated breath focus variation. Skip the twist and focus solely on the deep breathing. Inhale for a count of 4, hold for a count of 4, and exhale slowly for a count of 6. This extended exhale is a powerful technique to signal the nervous system to relax and bring down cortisol levels, which is one of the best things you can do for high blood pressure and kidney health. A special precaution: if you have uncontrolled high blood pressure, avoid holding your breath during any part of the exercise. Keep the breath slow and flowing. This final move has cleared your lower body, massaged your core, and lowered your stress. If you feel ready to add this gentle twist to your routine, comment 1 now. We have successfully completed the 4 gentle movements that create a safe, powerful, and effective start to your day. But before you rush off to try them, we must talk about a crucial detail that determines their success or failure: timing and safety. Let's move immediately to the vital guidelines for when and how to implement the golden 5-minute rule. You now have the 4 powerful movements: the air cycle, the ankle pump, the calf pump, and the seated twist. These are your tools, but like any tool, they only work if you use them correctly. The success of this routine hinges on 3 simple rules we call the golden 5-minute rule. The first and most important rule is that consistency trumps intensity. You might look at these 4 exercises and think, I need to do them for 30 minutes to make a difference. Absolutely not. For kidney health, gentle daily movement is far superior to sporadic strenuous workouts. Pushing yourself too hard actually releases stress hormones and can temporarily increase blood pressure, which is counterproductive. Our routine is designed to take 5 to 7 minutes total. Doing this short, mindful routine every single morning, even on weekends, will deliver cumulative, lasting benefits that a strenuous gym session once a week never could. Make it non-negotiable, but keep it gentle. The second critical rule is pairing movement with safe hydration. Your kidneys cannot filter sludge; they need fluid. After you have completed the 4 movements, your blood circulation and lymphatic drainage systems are fully activated. The pipes are clear and ready for the clean water. This is the perfect time to drink your pre-calculated safe portion of morning water. Refer back to our KH 151 video for your exact formula. The combination of movement, which mobilizes the fluid, and clean water, which provides the filtering medium, creates the most efficient detox environment for your kidneys all day. Do not skip the water immediately after the routine. The third vital safety rule is avoid exercising during acute symptoms. If you wake up with a feeling of overwhelming deep muscle pain, or if your ankles are severely acutely swollen and tender to the touch, this is not the day to exercise. Your body is telling you to rest. Also, if you have been advised by your doctor to maintain strict bed rest for any reason, or if you are experiencing chest pain, difficulty breathing, or dizziness, do not attempt this routine. Kidney health management always requires wisdom and listening to your body. Always remember to check with your healthcare provider or physical therapist before starting any new exercise routine, no matter how gentle it is. By following the golden 5-minute rule, being consistent, coupling movement with safe hydration, and listening carefully to your body, you turn these 4 simple movements into a powerful protective morning ritual. We have covered the why and the how. You now understand the science of flow, the danger of stagnation, and the 4 gentle movements that combat morning fluid retention and stress. It is time to conclude and discuss your plan of action. We have reached the end of this vital guide. You now hold the knowledge to truly wake up your kidneys and combat morning stagnation. Remember the key takeaways: gentle morning movement is not optional. It's the pump your kidneys need to clear stagnant blood and lymphatic fluid. The 4 core movements, the air cycle, ankle pump, calf pump, and seated twist, only take 5 minutes, but they are your daily shield against edema and toxin buildup. You saw those subtle signs this morning: the puffy ankles, the fatigue. These are alarms that should not be ignored. Kidney issues rarely announce themselves with pain. Damage often progresses silently. Delaying action allows fluid and waste to accumulate, forcing your kidneys and heart to work overtime. That's why starting this simple routine tomorrow morning is so critical. I want you to leave this video feeling incredibly hopeful. You don't need a gym membership or hours of time. You have the power to make a significant change in your kidney health using just your body and 5 minutes of focused attention. Believe in the compound benefit of small daily actions. Your plan for tomorrow is simple. First, decide where you will perform the first 2 exercises on your bed. Second, set a reminder on your phone for 5 minutes after you usually wake up. That's your start. Please remember, this video is for educational support only. It is not a substitute for medical advice. Always consult your physician or a specialized physical therapist before implementing any new exercise routine, especially if you have known heart conditions or severe joint issues. If this video empowered you to start moving safely, hit the subscribe button and join the Kidney Health 365 community. Turn on notifications so you don't miss our next crucial advice. If you're concerned about persistent foamy urine or swelling, click right here to watch our next video, Foamy Urine 4 Fruits and Daily Habits to Protect Your Kidneys, starting today. Thank you for prioritizing your health.